Wouldn't these elitists attempt to hoard the healthy foods for themselves and feed the masses unhealthy foods? Of course, there are actual physical divisions within this country as far as food goes. Places where is less access to foods, there's more food insecurity, there are distribution issues, people literally not having access to a grocery store or not having reliable transportation to get to a grocery store. These are real issues, and this misinformation, falsely claiming foods that are more accessible and are less expensive, falsely claiming that those foods are toxic or inflammatory, are not helping with any of these real issues. And in fact, they're just contributing to more issues and creating more harm that disproportionately affects people that have less access to food, that are food insecure. One example is misinformation regarding conventional food and toxic pesticides, and there's actually data showing that low-income shoppers that are being told that conventional food is toxic because of pesticides, which is a false claim, they end up just buying less produce overall because either they don't have access to organic or the organic is more expensive, so they buy it and they don't have enough money to buy as much produce as they would if they would buy conventional. This is a false claim that is more negatively impacting lower income families. This is what happens when more accessible, less expensive foods are demonized. That doesn't mean there still aren't issues regarding food access and issues with food insecurity and issues with getting fresh fruits and vegetables or even frozen or canned fruits and vegetables to make sure people have access to those things financially and geographically. That doesn't mean that those issues don't exist. However, spreading misinformation, demonizing the foods that they do have access to, that isn't a solution to any of these real issues. And again, it's just creating more issues, more confusion, and more harm. And this doesn't even get into the many different social determinants of health that impacts health outcomes as well.